Welcome everybody to this ISBNPA Early Care and Education Special Interest Groups webinar, the first for 2024. I'm just going to start with a brief information about the ECE SIG, and then we'll get underway. So the focus of our SIG is young children's engagement in out-of-home childcare, which includes infant care, nursery school, preschool, kindergarten, childcare centres or family childcare home providers. And we target nutrition, physical activity, sedentary behaviours, sleep during the early childhood period. Sorry. I just wanted to give you a few housekeeping notes before we kick off. We're obviously using a Zoom webinar system. You will have automatically been muted to prevent any external noise and any disruptions to our connection. But we do welcome any engagement from you through questions and comments. And please feel free to use our Q&A tab at the bottom of your screen and type any questions that you might have for any of the presenters, or we may answer those during the discussion time at the end. And for your convenience, it's usually easier to see the screen if you use the full screen mode. So just by way of introduction, I'm Dr. Penny Love. I'm based with Deakin University in Australia, and I co-chair the ECE SIG with Associate Professor Rachel Jones, who's also based in Australia. And we are supported by a raft of investigators, some of which are shown on your screen there, who are based across the globe in Canada, the USA, the UK, and Australia. And if you would like to know any more about the activities, join the leadership group, you can find more information on the ISBNPA website where the special interest groups are listed. So to formally get us underway, I'd like to begin today with an acknowledgement of country. As we're joining this webinar from physically dispersed places, I pay my respects to First Nations people of all the countries in which we live, learn, work, and play. And I recognise the long history that our elders of our First Nations people, past, present, and emerging, have had on our lands, our skies, and our waterways. And I thank them for the care they have given our lands for thousands of years. So the format of today's webinar is that there will be 3 presentations followed by a panel discussion. I'll facilitate the webinar, and then we'll have Jess, and then we'll have Audrey, Yolande, followed by a panel discussion. But to kick us off, I'm just going to play you a very quick video.
Our agri-food systems form the backbone of many economies, producing a wide variety of food essential to nourish everyone in the world. Across the globe, many millions of people suffer from various forms of malnutrition. Over 3.1 billion cannot afford a healthy diet, and food insecurity persists. Did you know that 13% of food produced is lost after harvest and before it reaches store shelves? While a staggering further 17% is wasted in our homes, supermarkets, and while eating out. Each one of us wastes an average of an incredible 74 kilograms of food every year. When food is lost and wasted, production resources are lost, greenhouse gas emissions are generated, and our ecosystems and biodiversity are threatened. Our common take, make, use, and discard approach to food is not desirable or sustainable. We have to do things differently. We have to focus on preventing and reducing food losses and shift our attitudes and behaviors away from wasting food. We must establish systems for measuring, monitoring, and reporting on food loss and waste, and engage with new sources of data to advance sustainable benefits. Shifting to circular agri-food systems that maximize the use of food for human consumption and keeping it out of landfills will increase efficiency, drive innovation, and benefit our environment, economies, and societies while protecting biodiversity. This shift requires the joint efforts of stakeholders from across several sectors. We can achieve our Sustainable Development Goal of halving global food waste by 2030 and reducing food losses by at least 25%. And in the process, we can all contribute to the transformation of our agri-food systems, nourishing people and improving the health of our planet. Let's work together to reduce food loss and waste toward transforming our agri-food systems for the people, for the planet.
Okay, so my first introduction is to Jess Haines, who is a professor of applied nutrition at the University of Guelph in Canada, and her research aims to bridge epidemiologic research on the determinants of health behaviours with design, implementation and evaluation of family-based interventions, including those focused on sustainable diets. Welcome, Jess.
Thank you so much, Penny, for that lovely introduction. And as you mentioned, I'm joining you from the University of Guelph in Ontario, Canada, which is located on the treaty lands of the Mississaugas of the Credit. And in Canada, we waste a lot of food. In fact, it's estimated that about 50% of the food produced in Canada is either lost or wasted. The majority of that is actually food waste, and a lot of that happens at the consumer or household level. Our own research, which is one of the most detailed assessment of household food waste in Canada, we followed about 100 families, or we measured food waste from about 100 families, all with young children. And what we did was we collected all their food waste over 4 weeks and weighed and measured each aspect of the waste. And what we found was that families waste about 3 kilograms or 6 pounds of avoidable food waste each week. And when we talk about food waste, we talk about avoidable and unavoidable food waste. Unavoidable food waste are things like banana peels or coffee grounds that are inedible and just happen when we prepare food. Whereas avoidable food waste is the stuff that had we managed it better, we would have been able to eat it. So think of the strawberries that go bad at the back of your fridge. That's avoidable food waste. And as I said, we found that families waste about 6 pounds of avoidable food waste each week. That translates to about $20 worth of food that they're throwing out, that they've bought and thrown out each week. Over the year, that's about $1,000 of wasted money in their food. And as Penny's video showed, that food waste also translates into a high amount of greenhouse gases. In fact, over the year, that level of food waste translates to about driving a car for about half the year. There's also a lot of health implications when we think about food waste. As you can see here by this figure, a lot of calories are thrown out by each family. And while we care about sort of the amount of calories, as a nutritionist, I also care about the quality of what's getting thrown out. And so when we look in detail about what families are throwing out, we found that 65% of what they're throwing out is fruits and vegetables. So a lot of the foods we're buying that are healthy are ending up in the bin. So this got us thinking about what could we do to help families reduce their food waste and hopefully improve their dietary intake as well. So we created a cookbook called Rock What You've Got. And the cookbook includes a number of tips. We partnered with Love Food, Hate Waste and created tips that help guide people on sort of what can they do to help reduce their food waste. So for example, planning out their meals. And then we also had 30 recipes that help families reduce their food waste. One category of these food wastes are what we call these 2-in-1 recipes, where we take the recipes for the ingredients from one meal and translate it into a delicious leftover the next time. So for example, thinking about sweet potato enchiladas one day and then an enchilada soup the next day as a way to help families learn to love their leftovers. And I've included the website here where you can find our Rock What You've Got cookbook. So the Rock What You've Got cookbook had really high reach. We've had over 15,000 downloads. And so it's sort of an exciting reach. But as researchers, we wanted to know, if families get this cookbook and other supports, can they actually reduce their food waste? And so that led us to the pilot study of a program called Weeknight Supper Savers. And this was funded by Danone Institute North America. And what we did was we engaged 19 families with children aged 9 to 12, and we used a pre-post design to test whether or not our intervention, did families like our intervention, and then also could we actually change some behavior. So what families received in our intervention was a food waste toolkit. So they received our Rock What You've Got cookbook, but we also provided some other tools to help around the skills that we know can help reduce food waste. So for example, we gave them some tools to help plan their food. We gave them some tools about how to store food in their homes to increase its shelf life. We also gave some tips on how to use up food. So for example, the pink container you see there was what we called the eat first container. So for example, when you come home from the grocery store and have new produce, I say to my kids, no, you have to eat this other stuff first that we had last week. Eat the apples from last week before you eat the grapes from this week. So the eat first container. And then up in the corner, we also have a vegetable brush that we use to promote cleaning things like potatoes and carrots rather than peeling them as a way to reduce food waste. So families got the toolkit. They also participated in an online cooking class with a chef. This is Kim, our chef. She led them through one of the recipes in the Rock What You've Got cookbook. And also we interspersed the cooking class with tips on how to reduce food waste while you're preparing food. And families prepared this particular recipe is from our clean out the fridge section of our recipes, which take a sort of really standard recipe and then you can throw in whatever veggies you have that might not be looking so great at the back of the fridge. So this one was the roasted chickpea burrito bowl. And this is one of our participants who did each of the steps on his own and was very proud of his roasted chickpea burrito bowl. We also sent text messages home to reinforce the messages that we were sharing around reducing food waste. My favorite one is really fruits and vegetables are good for you, but only if you eat them, right? Buying them is not enough. We have to make sure they don't end up in the bin and instead on your plate. So to give some context, when we designed this intervention, we took a look to see sort of what other household food waste interventions exist. And in a 2019 review by Kristen Reynolds, there was only 5 that specifically addressed household food waste as a way to reduce food waste at the consumer level. Since that time, there's been 3 additional interventions published, and none have focused on families. So we thought it was really important to engage children at an age where they could participate in creating the meals so that they could develop some of their own food literacy and food skills, but also so that they could have an interest and engage in thinking about their own food waste, so an awareness. And we were also novel in that most interventions don't use a really hands-on approach that teach that food skills in an applied manner. And we thought that was important too, again, for the kids to develop, but also the parents to develop and think through some of the skills they need and steps we need to help reduce food waste, like meal planning. So that's the context of sort of where our intervention came. And as I said, we used a pre-post design, and we were able to reduce the amount of avoidable food waste. And this was by about 420 grams. So that translates to about 4 medium apples in a week. So starting to reduce some of their avoidable fruit and vegetable food waste. We also found that we were able to increase parents' confidence in decreasing their food waste. We learned from children that they actually got a better sense of what the best before date was. So knowing that the best before date does not mean that it needs to go in the bin, but in fact, it's the language they often used was freshest before. It's freshest before that date, but it doesn't mean it's bad after. And we also were able to increase children's intake of fruit and vegetables. And this pilot project was led by Amar Leila and has recently been published in the Journal of Nutrition, Education, and Behavior. And Amar Leila was a PhD student at the time and is now working as a research associate for the Eat Lancet group. And we were thrilled to be able to participate with Amar, and we still get to work with him a bit now too. So that's who led this work. We also, because it was a pilot program, wanted to know whether it was feasible to implement this project and then what families actually thought about the program. Overall, the families found the project to be positive. They really enjoyed the cooking class and a chance to connect and cook with their children, and enjoyed learning new recipes. In general, families told us it was a fun program. They also really loved the what they call here a potato brush, but that vegetable brush was a real hit. And it's certainly a hit in our house too, as a way to help reduce the amount of food waste. They also told us that we had sent 4 text messages over the week, and they found that to be a high number. So going forward, thinking about reducing the amount of text messages. And they also told us that they really thought that the cooking class, although they enjoyed it, kind of went quickly. And so being thoughtful about ways that a future cooking class, maybe by being recorded, would allow families to stop as they needed to, because it was challenging to get everyone on the same page at the same time in the cooking class. But overall, it was found to be feasible, and certainly suggests that a larger intervention may be successful in reducing food waste. So a feasible project that could be tested to reduce household food waste. So building on that work, we have expanded our focus on sustainable eating to not only focus on food waste, but to also think about promoting plant-based proteins. As we know, many people are eating too many animal-based proteins, particularly meat, which can have adverse consequences for both health and the planet. And so we designed this recipe book that has a similar structure to the Rock What You've Got. This one's called Plant-Based Proteins Made Easy Peasy. It includes a number of recipes that helps incorporate some more plant-based proteins into some animal-based, so some mixed dishes that include both animal-based and plant-based, as well as some plant-based recipes that only have a plant-based protein. There's also some tips about where to find plant-based proteins, how to prepare them, and how to store them in this cookbook. So what we've done is taken this cookbook along with some of the content of our weeknight supper savers to create a program called Supper Heroes. This is a superhero themed. These are some of our superheroes you see here in our Supper Heroes project, where we try to help families reduce their food waste and increase their plant-based protein. This program is entirely online and includes 7 online, what we call missions, superhero missions, focused on developing skills to help increase plant-based proteins, increase their awareness of what plant-based proteins are, as well as developing these skills that we addressed in the weeknight supper savers to reduce food waste. We've built our program on the model. We've partnered with Kylie Hesketh at Deakin University, who used a similar online model for her Let's Grow program, focused on physical activity and reducing screen time in children. So what we do is have some infographics where families, some simple infographics where families learn, some videos where they're able to sort of watch watch as a way to learn various skills, and then a do piece of the project where there's online cooking classes throughout the online missions, allowing folks to learn sort of some of these applied skills. Our online cooking classes are recorded, again, learning from what we learned in Weeknight Supper Savers, and they're allowed to sort of go back and check as needed. So I'm going to end with a big thank you to Danone Institute for the funding. I'm going to leave you with 2 more things. One is where to find our cookbooks, which is at guelphfamilyhealthstudy.com. And lastly, where to find me. So thanks so much for listening, and I'll pass the floor back to Penny.
Thanks, Jess. Probably got time for one question. I haven't got anything coming in from the participants, so feel free to pop any questions in the Q&A. One question was the, what was it called? The Rock What You've Got intervention. Had you thought about, if you were going to scale it up, what that might look like in terms of cost with all those different components, potato, scrubbing brush, and all those other things? How feasible is it?
For sure. I think, so we have costed it out to get a sense of sort of, and in our Supper Heroes, which is hoping to be the scale up. So we are currently pilot testing Supper Heroes with a hope of sort of scaling up. The online piece will be a little less expensive because we can make sure that, so for example, we don't need in-person cooking classes. They're now all moved online. So increase accessibility that way. And we've toned down, we don't have as many things in our toolkit. We focused on the things that families liked the most, but the vegetable brush did stay in as one that they particularly like. So I think now our cost for the toolkit's about $20. So not too expensive. Yeah.
Yeah, that's great. Good. Thanks so much. And we'll see you back at the discussion panel.
Thanks so much. Take care.
And Audrey is with us. Good. I saw you pop off and but you're back. Or has she frozen? I hope not. Can you hear me, Audrey? You're on mute, Audrey. Can you hear me?
I can hear you. Can you hear me?
Oh,
okay?
yeah, yes, I can now. Yes, good. So welcome to Audrey Elford, who's recently completed her PhD studies at Deakin University, and her thesis was titled Towards Sustainable Healthy Food Provision in Early Childhood Education Settings. She's currently working as a research fellow for Deakin University here in Australia on a number of projects related to food provision in early childhood education settings, sustainable healthy food systems, and measuring foods and food waste, developing a tool specifically for environmental sustainability and food provision in the ECE. So over to you, Audrey. I hope she hasn't frozen. Jess, are you able to hear me still?
I can hear you.
You can hear me, Antonio?
Yes.
It might just be Audrey.
I think it's only Audrey that she's
having problem. Oh,
yeah, maybe she's dropping and joining again, hopefully.
We'll give her a few seconds to join. Otherwise, I might jump to you, Yolande, if that's okay, if Audrey doesn't join us.
That's fine with me. You can just say if you want me to.
Okay, I'll give her another couple of seconds and see. All right, we might jump to plan B and just swap the speakers around, which is fine. There's no particular order. So Dr. Yolande Smit will present to us now. She holds a PhD in nutritional sciences and is also a lecturer at the Stellenbosch University in South Africa. Her research focuses on food provisioning environments at early childhood development centres, and particularly looking at how to support an enabling food environment. And beyond her academic pursuits, she engages with non-government organisations, healthcare professionals and policymakers, translating research findings into actionable strategies for improving food services at various institutes and different platforms. Over to you, Yolande. Yolande, are you there?
Yes, can you see my screen?
I cannot see your screen and I can't see you, but I can hear you.
Okay, let's just try it again. Share screen. Yep. You still can't see my screen?
I can see your screen.
Oh, you
can just pop it in. Yeah, you just need to put it in presenter mode for us.
Yeah. Okay.
Yep, that's perfect. And then you can pop your own camera on if you would like to.
Yeah.
You're on notes now.
I'm on notes now. I don't want to be on notes. Let me just see if I can change that. It worked perfectly just now. Is that slightly better?
That is perfect.
Okay, and my camera is on?
I can't see you.
Let me see, why is that? Start
There we
video.
are. Perfect.
There we are.
Off you
Okay.
go.
Yeah.
Good afternoon, everyone, and thank you, Penny, for the introduction. Today, I will be providing you with a snapshot of the Early Childhood Development Centre's food provisioning environment in South Africa, with a focus on food waste. So, as we've heard, food waste is becoming an increasing global health issue, but so is global hunger. And this has been emphasized by including it in the Sustainable Development Goals, and especially Goal 12.3, calls for halving of food waste at retail and consumer level by the year 2030. So although South Africa is seen as food secure at national level, there's still a very high percentage of at least 25% of our households that are indeed food insecure. So even though household food security remains a concern, research shows that South African consumers are responsible for about 4% of overall food waste. And in sub-Saharan Africa, the figure is basically similar. What is noted here is that these figures are lower than that if we compare it to other European countries, for example, which has food waste of about 42%. So the reason for wastes are listed here on the slides, but specifically perhaps the limited resources and storage facilities, as well as the low awareness of food waste and the implications thereof, could be reasons that drive household food waste, but that is more specific for low and middle income countries. So the items that's wasted most in our households are fruit and vegetables, I think similar to what we see in high-income countries, and then also our staples, rice, pap, and bread, which is the staples of most South Africans. So obviously, food waste aggravates the problem of hunger and food security, especially in the most vulnerable populations, and especially in children. So why should we be concerned about the nutritional status of specifically children in South Africa? So South Africa faces the double burden of malnutrition, where we can see that if we look at the high prevalence of stunting at 27%, which is an indication of long-term malnutrition, but then we also have high levels of overweight and obesity at 13%, which is almost double that of the global prevalence. So, and this is specifically for children below the age of 5, and this is also the years that children then attend ECD centers. So what do we know about the attendance of ECD centers? So approximately 25% of our children are enrolled in some form of early learning program, with 70% of these children being between the ages of 3 and 5. So I think this is quite important, because that is the age where children start to form their own eating habits and make their own decisions, but they also have quite a strong influence on parental decision making. So keeping that in mind, if we think of food waste and how children can act as change agents. Then I also just had to show you and emphasize that not all our ECD centers have access to running water or even taps to wash their hands. And in the context of food waste, this becomes a problem, because we have to ask now, how does this influence hygiene? How does it influence food waste? And how can it actually, and food safety as well? So I just included the next slide also to show you that in a study conducted in Cape Town, where I was part of, we saw that almost a quarter of ECD centers actually have vegetable gardens, and I have 2 pictures here, but unfortunately we didn't look at what the contribution of these vegetable gardens was to the actual menus that was served to the children. And I think it would have been interesting, but unfortunately we don't have that information. So most of our ECD centers provide at least 1 meal a day, and if a center is registered and qualify, they can apply for a subsidy for meals, which is about 15 Rand, and of which 40% of that goes to food or nutrition. And the exact cost of our meals are not really known. And what we know from self-reported data, again, based on a study conducted in Cape Town, managers said it's about R8.94 per child per day, which is slightly higher than that of the subsidy that we have access to. Now, as we can see now from a previous slide, many children have access to ECD centers, they attend these centers, but and many meals are prepared there, but what actually guides meal preparation at these centers? So in South Africa, we have our nutrition guidelines and with the purpose of ensuring safe and nutritious food. But unfortunately, one big challenge that we face is that from the results from the study conducted in Cape Town showed that only 11% of the ECD managers were actually aware of these guidelines. So we then have to ask, or just to note that these guidelines are not legally binding. And we have to ask, how do they actually then plan the menus that they serve to the children at the ECD centers? So here I've just included some pictures of the menus that were presented at the centers. And you can see here that it's quite vague. It doesn't give a lot of detail. It doesn't indicate portion sizes, and the format also differs. And one of the other things that we saw is that the menus that was actually displayed at the ECD centers didn't necessarily represent the actual food that was served in these centers. So when we think of food waste now, and in the context of food waste, we have to ask, how do they know how much to actually purchase, or how to plan on what they are actually going to prepare on that day? So we then did interviews with some of the managers, asking them how do they design their menus, and basically they said mostly it's driven by their own habits and culture and context, but then also what the children like. So here we need to ask the question, sometimes strategies unintentionally to avoid food waste might be at a nutritional cost. And we can debate that later on. Some of the other reasons for poor compliance that was given by the study participants was that they just basically plan according to what they have in their cupboards. They want to avoid food spoilage and then also food waste, and therefore they wait until they purchase new items, so they first use what they have. So basically a first in, first out system, which is good, but we might there sort of have a negative impact on the nutritional adequacy as well as the dietary diversity of the menus that is actually served at these centers. So on the next slide, I just tried to show you that also when we looked at the actual meals served, it was a bit concerning that very little of the ECD centers actually serve the recommended number of portions of any of the food groups that was stated in their guidelines. So specifically for vegetables, fruit and dairy, only 2 centers served the recommended number of portions for vegetables, only 9 for fruit, 2 for dairy again. And this is quite concerning, because this is actually the food groups that we know South African children have very low intake of, not just the vegetables and fruit, but also a dairy product. So this concern will be exacerbated if there's high levels of food waste. Now, unfortunately, we know very little about food waste at ECD level, and very few studies have actually explored that. So on this slide, I've just included several other studies that also found similar concerning results about the nutritional adequacy and dietary diversity of the meals provided. But important to note that even these studies, when they looked at the nutritional adequacy, it was basically based on the menus, the written menu or the food served, but none of these studies took into account plate waste. So we don't actually know what serving waste and plate waste looks like at these centers. So then I went on and I found one study conducted in Vietnam that actually tried to quantify food waste. And it was found here that 23% of total food were wasted at these early childhood development centers or in schools, and vegetables again was the item that was wasted most. The interesting finding here was that when portion sizes was bigger, the children ate more, but they also wasted more. So there seemed to be a little bit of a toss-up or a trade-off between food waste and improving nutrition and some sort of portion size effect in terms of our food waste. So then moving away in South Africa and moving to the school setting, we have the National School Nutrition Program, and I found one study that actually evaluated or asked some questions about food waste, specifically in schools that participated in this program. So they asked here, how much food do the participants think is wasted? If there's waste, what items are wasted most, and then if there's a waste management program. So what this study found was that the participants felt that there's little to no waste. If food was wasted, it was basically vegetables and protein usually because of the addition of soya to stretch the protein source and to keep the cost lower. And then in terms of waste management, although they said, yes, there's a waste management program, so there was awareness of the type of program, it was found that when they would delve deeper into that, the leftover food wasn't used, for example, for compost, as stated in the program, but it was actually discarded in the bins. So yeah, we need to also keep this in mind going forward, and if we want to plan further strategies. So other reasons for plate waste in South African schools then participating in the National School Nutrition Program was the fact that there's a lack of portion control. It could be portion control, just not having portion utensils, not having scales, those type of things. Not all learners come to school, so it's very difficult to calculate the exact number of children that they have to prepare meals for every day. It was found that the taste of the items or food prepared wasn't always acceptable to the learners, and that led to food waste. Then in terms of the quality of the food, I think it's important to see here that it's not only just the quality in the way it was prepared, but also quality of the actual items that's delivered to the schools. Sometimes it's delivered too late and then it goes off before they can use it, or it's actually too ripe at the point of delivery. So yeah, basically, something to take into account when we actually look at the food service system. And then again, it popped up that the lack of storage and access to water to clean the storerooms could impact on food waste. So just to summarize some strategies that one can implement to actually reduce food waste, specifically in low middle income countries. I think it's extremely important in our context that the menus, yes, we should keep child preference in mind, but the menu should also be culturally acceptable without compromising the nutritional adequacy, which is obviously easier said than done. Then in terms of quality training, there's a lack of training specifically for our food service staff and staff working at schools and ECD centers. Many times it's volunteers working there. So to train these people how to prepare meals, how to prepare it in a healthy way, and then also do the calculations and work out how much should be prepared to keep portion sizes in mind and follow recommendations. Then funding, I don't think it's probably always a challenge, but specifically funding to ensure that we can serve a diverse range of foods at these centers. Public-private partnerships are very important to get funding, but then also funding not just for the food items, but also for storage equipment, for example, for all facilities, because not everyone has access to, for example, fridges or freezers. So that is something that we have to keep in mind, also when planning menus. And then to integrate health and environmental approaches so that we can raise awareness amongst our young children, and to make sure that food waste is and how to address this becomes part of our school curriculum, so that we can really start young and create awareness of this problem going forward. So I think my final message would be that food waste equals nutrition waste, and we should not underestimate the power that our children have, and they are change agents. And if we can raise awareness at our children and our teachers, they can also take this message home. So the school environment are an ideal entry point to introduce a variety of healthy food items, but this should be done without the fear of wasting food. So that is my message in a nutshell. And I want to thank you for the opportunity. My email address available. I've also included some of the references that I used if you wanted to have a look at those. Thank you.
Thanks very much, Yolande. That was really interesting. I am going to save, I've got a handful of questions, but I think I will save those until we have our panel discussion. And I think the change in the order is actually quite good, because I kind of know what Audrey's content's going to be. So I think it's worked out really well. So over to you, Audrey.
All right, I'm so sorry about that. We've had a little glitch just before, but I agree with you, Penny, that I actually think that this order is really good, because as I was listening to Yolande's brilliant presentation, I thought the research that we've conducted is going to beautifully complement what you have presented. And I'm just wanting to make sure, Penny, now, given that I did have a little technical glitch, that my sound is working well.
Your sound is perfect and your slides are great. You can see it.
Great. Thank you so much. So I do want to just acknowledge my wonderful team who on the slide, who was my supervisory team. And all of this work we did together with early childhood education staff, as well as Nutrition Australia's Healthy Eating Advisory Service. So I'm going to just take a slightly different angle to Yolande, in that in early childhood, and it really complements what you've just said, is that we've got this really, it's quite a unique part of the lifespan, because we are needing to ensure that children are developing taste preferences, and, for this, repeated exposures of food is often required, even if they refuse it for the first time. So this becomes then a little bit difficult when we consider this in the context of food waste. It's also when children are developing their habits, and so the foods that they enjoy at this time and the preferences that are formed is going to last them for a life. It's going to have lifelong implications, but also their habits around food waste, like Jess mentioned, the type of practices that they put in place now, and being aware of food waste can really have lifelong implications too. And then there's the fact that there's this opportunity for children and young children to be and become eco-citizens, and really being able to feel this responsibility and feel empowered in contributing to environmental sustainability. And at the same time, like Yolande mentioned, there is some research that's shown that, children will go back home and try and, improve things at home if they've learned something at school or in an early childhood education centre as well. So our research was specifically, I'm going to call it ECEC, Early Childhood and Education Centres. This is particularly now in high income countries. I'm talking about it from that angle. There's a very high uptake of early childhood education and care. So for example, in 2020, 44% of children under the age of 5 attended ECE in the UK, 61% in New Zealand. In Australia last year, we had over 800,000 children attending centre-based care. And so they attend these settings for quite long periods of time as well, on average 3 to 4 days per week. And the recommendation is that they should be receiving 50 to 67% of their daily nutrition whilst attending these settings. Now, I've recently been to a seminar where they said we should try and present our work creatively, and I've given this a go. So I want to just take you through some of the background research and some of the things that we found in our research around this idea of focusing on diet quality only or focusing on food waste only. So if we start on the left-hand side there, if we have this diet quality only focus, and this is quite often where the recommendations are sitting at the moment. So the guidelines are health focused without really taking the environmental sustainability into consideration. Then you might have ECE centers that's striving to provide food that meet these guidelines, but quite often they don't actually know how much food they're wasting, similar to what Yolande mentioned in South Africa. And so then our bin over here saying, whoa, hang on, it's the compost bin. I'm filled to the brim with food waste. And even my mate, the normal bin, is full as well. Now, if we focus on food waste only, there is also this potential of potentially the cook, for instance, saying, we don't want to serve that food because the children don't like the vegetables. Maybe we should serve less vegetables. It's expensive. Maybe the educators, you would feel like they need to pressure the children, and this has come up in some previous studies. They need to pressure the children to finish the food on their plates because then they'll waste less food. And the children trying to be responsible eco-citizens might also try and finish all the plates on their foods and are not listening to their satiety cues. So in the middle there, we've got the earth saying, or the planet saying, how about simultaneous messaging? And this is really what Conrad et al. Suggested in their paper that I've got referenced there, to say that when it comes to food waste and health, the messaging needs to occur simultaneously. And that's really what we based this research on. So we used, in our co-design, we used the FAO Sustainable Healthy Diets Guiding Principles, which focuses on food waste, but also the healthfulness of the food. I'm not going to spend much time on my method. So if you want to get in contact with me, I'll briefly mention that we used the co-design framework called the IDEAS framework. And the reason why choosing this is partly because it has a section there where it's embedded in behavior theory, and we use the theoretical domains framework for this. So I'm going to take you, and the co-design was between ECE staff, Healthy Eating Advisory Service, and our research team. So I'm going to take you now through the data collection points. So first we had a survey that was based on the Sustainable Healthy Diets Guiding Principles, and we really wanted to know more about the food they served, environmental sustainability, and this included food waste. Then we had, in a set of centres, we had self-administered weighed food served and wasted audits. And yeah, we actually, Yolande, you mentioned serving waste and plate waste. We measured both. So we measured the food that was served so that we could look at the healthfulness of the menus. And then we actually looked at the food that was prepared but never plated to the children, which we call serving waste. And then we also measured and weighed the plate waste. And then 2 weeks later, we conducted interviews with that subset, and then we had focus groups. And throughout this, we had meetings with Nutrition Australia so that we developed and co-designed some support strategies. So for the surveys, we had 129 centres and staff from centres that participated, and for the weighed audits, 12 centres. And I'll just pick out some interesting findings. So the first thing was that there was low food waste awareness. So only 8% of those that filled out the surveys had ever conducted a food waste audit previously. And the centres who had conducted food waste audits actually made some practice changes. So they made some changes to their menu, or they made some changes to how they managed their food waste. A third of the centres also did not actually engage in unavoidable waste mitigation strategies. So this is now things like having a worm farm or a compost bin. And then we had our audits. And yeah, our food waste ranged from 9 to 64% of the food served. And on average, it was 27%, so a bit higher than that 23% that Yolande mentioned in this particular study. So the serving waste was slightly higher than the plate waste, which was an interesting finding. And then we also found, even though it was a small study, that there was lower plate waste in centres who had previously conducted food waste audits. So this seems to, together these findings, we wanted to discuss in the interviews with the centres, what's happening when you find out about your food waste, or, when you did this audit, did it lead to any changes, this sort of awareness. And so we 2 weeks later had these interviews, and these are some of the main findings that we had. There were the main themes, was that there needed to be a focus on food waste and how to manage it. If it wasn't a focus in the centre, they had no idea. And they found that doing these weighed audits was very useful, but it was not that practical for them. And they said it's not something that they would regularly do. It was quite, intensive, labor intensive. There was a very strong theme coming through around a whole centre approach needed. So what do we mean by that? They meant everybody, the director, the cook, the educator, the children, all needed to be involved for anything that's going to target food waste in a centre to be successful. And so Nutrition Australia provided some additional, they put over a very practical feasibility layer to look at how can this be scalable, whatever we develop. So we should really try not to do too high involvement strategies. And that was, yes, we should focus on how they, composting and stuff like that, but we should really look at how can we reduce it in the first place. Some of the main themes that came around there was that cooks needed to prepare the right amount of food. Educators, and this came through in every single interview, that educators needed to sit with the children and model the eating, and that they perceived that this led to lower food waste. Then children being involved, not only in the activities, but actually the solutions, which was it was a great finding. It was a great theme, and just speaking about how children really should be involved in even creating the menus, which was brilliant. And then Nutrition Australia suggested, based on these themes, should we be looking at something that could be something that involves the children, has got an educational component to it. And we took that back then to the focus groups to refine all of this. And so in the focus group, really the whole of centre approach was mainly the topic, and they discussed very much like, what is every person's role? And so the director's role is to create this waste aware culture. It needs to be in the policies, it needs to be in the communication, it needs to be something that is consistently communicated. The cook needed to be quite responsive to the numbers on the day, and I'll talk about that in a next slide a little bit more, because it just is about, some centres, for example, had 100 children enrolled, but only 80 children arrive on the day. Now you're preparing meals for an additional 20 children, and that's really where a lot of this serving waste came from. And then the educators sitting with the children, modelling the eating, talking about food waste, was perceived to be very useful. And then this food waste awareness activity for an awareness week or month was developed. Key is that it needed to not use expensive equipment. It needed to be stuff that's around the place. And the idea would be to appoint a daily waste warrior. Children would scrape their food waste into a bucket. Our waste warrior will put their little ruler in there, and the kids will then discuss this in group time and come up with solutions. And an example that was given is that, say, for example, they serve pumpkin soup and a lot of it was wasted. Maybe the children can discuss Why? And is there another way that pumpkin soup can maybe be served? Because we don't want pumpkin to be taken off the menu. We want some solutions to how we can maybe waste this a little bit less. And then, of course, reading books to the children as well. So 3 key takeaways is this idea of awareness that can elicit practice change. And we do need to research this further and make sure that it doesn't have any unintended consequences. We don't want it to affect the feeding practices negatively, like I showed in that cartoon slide. The whole of center approach, everybody needs to be involved. And then this idea of the serving waste versus the plate waste. So the serving waste was believed to be more to do with the planning of the menu, the responsiveness to the number on the day. And then the plate waste was perceived to be more the modeling and the feeding practices of the educators, and they needed to be involved. So our next steps now for this research is we have received some funding through Deakin University to do an intervention study on these resources, to test them for feasibility, effectiveness, and to consider whether any of these unintended consequences occur, as whether hopefully we've set it out nicely and it doesn't. And we're also actually doing a reliability study on that self-administered food audit that looks at food served and food wasted. So thank you very much, and apologies again for our technical glitch there. If you have any questions, my email is there.
Thanks very much, Audrey. I'll ask everyone to pop their cameras back on, and I'm glad that Zoom hasn't defeated us, but it's certainly chosen to eat away our time. So I think what I will do is ask one question that I'll give you, a second to think about, and then I'll give you each time to answer it. And it's one of those, I think all of you have talked about unintended consequences and something that we need to be aware of. And seems to be that the food most wasted, which is vegetables, is the one that we're most in need of actually trying to be most adequate, and it's the least adequate of our diet. So what do each of you think in terms of this desire to integrate health and environmental sustainability into a set of recommendations? Do you believe that that's feasible? And where are your sort of immediate thoughts of, this is how I might approach it, given some of you are working in the home environment, schools, early childhood? So anyone who wants to go first is welcome. I know I'm putting you a bit on the spot. Yolande, you're on mute. If you look like you're talking, so I'm...
Apologies. I think perhaps based on what I've told you, to have recommendations and have recommendations, nutrition guidelines with, like Audrey said, the main focus there usually is nutrition. Having said that, it is important, and what we know about food waste, and that is increasing, and if we think food waste and food insecurity, it just does not make sense. So we need to find ways to sort of close that gap and find that sweet spot between serving nutritionally adequate food without wasting it. So my take on it is that for us, we have recommendations, but like I said, those recommendations firstly need to reach all the ECD platforms and centers so that they are aware of it. But then if we introduce, for example, recommendations on food waste, that it's not introduced in a way that it's another thing that we have to focus on and another thing that we have to worry about, but that it almost happens automatically. And in a way, how I see that to happen automatically is by, our guidelines also have reduce, reuse, recycle. It's there, but it's not really practical, and it's not giving the how should we do that. And I think our other speakers came up with excellent ideas, and have recipe books and have videos. We have a bit more of a challenge there because not everyone has access to, the internet or data, or this distribution might be a problem. But if we can get a way of getting the message out quicker and better, to integrate the food waste approaches, but in a way that it's not something new, and it must be practical and showing them what can we do without, you know, making them feel it's now something new that I have to worry about.
Thanks, Yolande. And thanks for reminding us of the different contexts that we're talking about, low, middle, and high income countries. Jess, did you want to add anything?
First, I had to tell my family to be quiet. I really like what Audrey brought together, which is some of the feeding practices that we would have parents or childcare providers do for health, like eating with the kids, also helps that reducing the food waste. The other tip we give to families is, which is one we would do for health and for food waste, is just give the kids a little taste of something. If it's new and a novel food and you're not sure it's going to be accepted, overwhelming a child with too much on their plate is also going to be that they're less likely to try it, and it leads to food waste. So interestingly, there's some nice intersections of sort of practical feeding guidance that we would give anyway, related to nutrition, that fits really nicely. And I loved that Audrey found that in the focus groups where they said, actually, that is something that they wanted to do. So I think that's a really nice reinforcing message. Thanks, Jess. Audrey?
And I agree. And I think the fact that the fact that it's a cost saving, and Jess spoke about that from the home setting, and we spoke about that in the ECE setting. I think this makes it feasible for them to focus on it in a way, like it might motivate them to focus on it. But I think, yeah, for me, I've mentioned it already, but what set me on my whole path for research was actually a paper that I found that set out to actually measure whether menus were meeting guidelines, and they met the guidelines, but they wasted 64% of vegetables. And I think it was, from memory, 43% of fruit. And I was like, why? We can't be pushing for this. We should be considering it. But what I have seen now, and I think that this needs to be the future, is any research conducted in, for example, ECE, or perhaps even in households, should consider what are people having and what are they wasting? Because I think these should just be measured together. And the messaging should be happening together, and the measuring should be happening together. And I think it's certainly from a business perspective for ECEC, it's in their best interest to look at that, because it is money as well. Yeah.
So we could probably talk for another half an hour, but unfortunately our time is coming to us. But I thought what I would do is just end with, I think what I've taken from all of you is that there is probably a sweet spot, and there is a certain amount of food waste that will occur, and stuff that the expected food waste that Jess sort of talked to, and it does come with, you know, a balance. And just to remind everybody who's listening in or who watches the webinar, this is a strategic goal of ISBNPA, is to really look at meeting environmental sustainability as well as our health strategies. And this is something that we've taken very seriously at our conferences. And I was delighted to see a recent announcement that at the Omaha conference, there's a vegetarian option, you know, default. So in speaking to the ISBNPA executive, they've said, you know, this is being done by using locally sourced food, and it may come at a slightly higher cost, but the offset of that with carbon emissions is that maybe there is a slightly higher cost that we need to add to the value of our food on our plates, so that we can then have some planetary health outcomes. And it's that balance. So thanks again very much for all your time, and I'm looking forward to catching up with all of you at a later stage. New Zealand is after this year, next year for ISBNPA. Let's see what we can do about environmental sustainability and health there. So good day, good night to all of you, and thanks very much, Antonia, for your support.
Thank you so much.
Thank you so much.
Bye all.